Hello, everyone. I'm Randy Murphy, epidemiologist and director of disease surveillance at the Mobile County Health Department. Today is Friday, June 24th. It's been a few months since we last spoke via Facebook Live. I'm here today just to give you a quick update on the status of our COVID-19 pandemic. There's been some exciting news in the last week or so on the availability and approval for an authorization of COVID vaccines in much younger age groups. And it's my pleasure to introduce our new health officer. He's been here maybe 4 or 5 months at this point, but he's going to join me today and talk to you about some of the new products and new age groups and answer some vaccine questions. So Dr. Kevin Michaels.
Good afternoon. I'm Dr. Kevin Michaels. I'm going to talk about the COVID vaccine for 6 months to 5 years old. It's now available at the health department, the Pfizer vaccine, and then beginning on Monday, we will have the Moderna, so both vaccines will be available. I've received some questions regarding recommendations for infant and children taking the COVID-19 vaccine and other vaccines needed for school. Yes, you need to take. Would recommend you take the vaccines. Need to take the vaccines in preparation for school, and during the summertime it's a good time to get caught up on all the vaccines. You can come to any of our clinics for the COVID vaccine as well as school-aged vaccines from that standpoint. Another question that was asked was what are the possible side effects to keep an eye out for after getting any vaccine really administered. And typically, vaccines will, in most cases, cause a low-grade fever or some injection site pain. And sort of a follow-on question is what over-the-counter medication should parents have on hand to combat possible fevers or reactions to the vaccine? What I would tell parents to do is talk with their healthcare provider regarding what they should do as far as either acetaminophen or ibuprofen, and confirm what the dosage would be based on the size of the child. But most side effects are going to be self-limiting for a day or two. If the pain is extreme, then you may want to follow back up with your provider. Another question that was asked is, since healthy children have a low risk for serious consequence of COVID, why is it necessary to get vaccinated? Well, the vaccine produces protection in a controlled way versus having a child become ill. So why have the child become ill and we're not able to predict whether they'll have mild or severe reactions. So it's a safer way to protect the child or protect anybody from COVID. The last question I had is there clinical evidence to support vaccinating healthy children who already had COVID? Well, it all depends on how severe the illness was from how severe the illness was from COVID. The long-term effects that we know through time, person loses the level of protection. The vaccine controls that, and we also know from other studies that those people who had the disease and were not vaccinated typically may get the illness again a second or third time if they're not vaccinated. So again, I've answered those questions. I mean, the vaccine is a safer way to offer protection to children versus getting the illness. The other thing I want to emphasize, the importance of completing the recommended or required childhood immunization requirements for school. Now is a good time to start to look at where they are in the immunization cycle and make sure we get them vaccinated. I will be followed by Dr. Murphy.
Thank you, Dr. Michaels. Yeah, it's always good when our health officer can stop by and provide some of that medical insights that we need and appreciate during this time. So again, I'm just going to talk a little bit about the trends in COVID cases, hospitalizations, percent positive, and deaths. It's been, I think it was March, right, Mark, the last time that we did a Facebook Live update. We are still producing our weekly reports and sharing those. We have a public-facing dashboard, but because COVID has really accelerated in the community, we thought that it might be a good time to come on and talk about the great vaccines, the very safe and effective vaccines that are available now for anyone 6 months or over, but also just to give you an update of the COVID trends. So COVID cases have been on the rise for some time. Right now we're seeing a 14-day average number of COVID cases just over 102. And back in April, which was our lowest point, sorry, that's thunder. In April, we saw the lowest number of COVID cases reported to us in any month since 2020. And since then, you know, in April, we were seeing maybe 10 cases a day, sometimes 14, but now, again, we're seeing on average just over 100 new COVID cases a day. And remember, this is an underestimate because there are a lot of at-home tests available now, and those are not reported to public health. So we know that there's a lot more transmission in the community than we learn about, but the trends are trustworthy because our surveillance system has been in place now since 2020. So, you know, April is when we saw the lowest number of cases. In May, the number jumped up almost 3 times. And compared to May, we've already seen more than twice the number of cases in June than we saw in May. So be careful out there, everyone. Remember, personal responsibility, get vaccinated, layer on those prevention measures if you're in higher risk areas, or if your health, if you're at higher risk of complications. Wear a mask, distance, avoid large social gatherings, indoors, those sorts of things. Other indicators that we look at are the number of hospitalizations. They are still fairly low, but the 14-day average number of people hospitalized with COVID is just over 40, so at 41. And again, back in April, we were seeing, you know, less than 10 most days, sometimes as few as 4 or 5. So it has jumped up quite a bit. And also, the hospitalizations are not just in people who are older or you know, we have, I think right now, about 10% of the COVID cases that are hospitalized are in children less than 12 years old. So that is a major concern. Just want to make sure that everyone understands that severe illness and complication can strike anyone, but it does tend to affect people who are not vaccinated, have underlying health conditions, or are older. And then the percent positive. So of all the tests, COVID tests that we know about, how many of those are positive? And right now, it's about 15% of all tests reported to us are positive. That is higher than we'd like for it to be. So again, just take some personal responsibility, consider your risk, consider the risk of the location that you're in deciding to layer on prevention measures. Our community levels have also jumped up. Our community transmission levels, those are the ones that our healthcare providers and healthcare systems really need to look at. The entire state of Alabama, except for one county, is the red, or the highest community transmission level. And then looking at the community levels, this is the more modern indicator to tell us what the community members should be considering. We had been low for a couple of months, and we have inched up to the medium community level period. So I won't talk much about vaccines. Dr. Michaels did a great job covering that. Again, just today, Moderna approved, recommended for children 6 months of age and older. So now both Moderna and Pfizer are authorized for 6 months and older. So any COVID questions, Mark? Okay. The last thing I wanted to just touch on very briefly is the new outbreak. Hopefully it won't become a pandemic, but the new outbreak that is upon us, and that is monkeypox. So it is an extremely rare disease caused by a monkeypox virus. Causes sores or the pox, a rash. Sometimes it's preceded by flu-like symptoms. It spreads through personal contact. Contact can happen just skin to skin, but in this outbreak, it seems like it's happening with intimate sexual contact. And while you have to have sort of direct skin-to-skin contact with a pox with a sore to get infected. We're still learning more about this outbreak. So stay tuned on that. The good news, the great news, is that there are currently no cases in the state of Alabama. There has been some testing, but it has all been negative so far. But just to share with you that there have been cases reported in 25 states, including Florida and Georgia, and a total of 173 cases reported so far. And worldwide, this monkeypox outbreak, occurring in countries where it's not normally found in rodents and monkeys. Cases have been identified in 54 countries and over 3,500 cases. So we want people who maybe are traveling to countries where there are outbreaks, stay vigilant about looking for the pox. Don't be alarmed, but if you have traveled to one of those countries, we want you just to monitor yourself for 21 days after you return. And if you have close, intimate sexual contact with someone that has a pox-like lesion, please, again, continue to monitor yourself. And if you do develop symptoms, contact your healthcare provider as soon as you can. These are mild illnesses, usually self-limiting. We can even do better by offering some vaccination or some antiviral treatment for people who do get it. So there have been very few severe illnesses. So we're just trying to make sure that we think about it, hope for the best, and prepare for it if it does come into our state and county. So with that, I'm going to end for today. Everyone, be careful and safe out there. Protect yourself and your children. And if you haven't gotten vaccinated for COVID-19, it's not too late. Check our website, mchdcares.com, for the locations where you can just walk in and get a COVID vaccine, and testing by appointment at our locations. Have a great weekend, everyone.